till our friends join. Luke, so we have already discussed a little bit about Sarcodes,
Mm.
and we have had few lectures on Sarcodes. Of course, the
Yeah.
Sarcodes that we use, and a little bit of overview about clinical experience by different colleagues, myself as well, and all senior colleagues as well. So yours is going to be a kind of a talk where you will be sharing, of course, your experiences. We discussed about certain
Yeah.
Sarcodes or remedies around it.
Mm. Mm. Thank you. Yeah. I'll talk about provings really because
Yeah, go ahead. Please
that is
go ahead.
that is the main area of experience, and I'd like to, if it's, I don't know what the normal format is, but I really prefer discussion rather than just presenting, and so I'd love to have a discussion about provings and their role in homeopathy and how we see that now, as opposed to how it was seen in Hahnemann's era and in Kent's era. Yeah.
You can surely. We have some amazing participants, and they are very, very interactive with the
Yeah.
discussion and questions and answers. And although we'll try to keep a little bit of question and answer in the end, because I'm sure so many of them will have so many questions. I don't want to take you away from the topic. This happens very often. You already know how the talks happen with me.
And,
So,
and
so
you and you know what I'm like, and I love going. So yeah, you can rein me in when you want to.
No, no, it will be totally like, the way you like it, because I feel that you should have your own free-flowing thoughts are the best. Huh? Some
Yeah.
cases also, maybe some case experiences also.
I don't have a lot of case experience so far with sarcodes, I must admit,
Okay.
apart from the thyroid inum. But I'm sure it's a simple thing that you've probably talked about at length already. So I can.
What about do you also use sometimes, because this intrigued me, because of course I have your book on my table just for you to know, and I really
Yeah,
like it. I
thank you
have
very
it signed by you also.
You do. Nice. From our time together in England. Yeah.
Yes, yes. So
Yes.
I wanted to ask you, because we are using a lot of animal remedies, and I know that your work on animal remedies is, well, quite exhaustive, and you are, I know, also developing so many other matrix and permutations and thought process. At this moment, it's not at
Yeah.
my level, it's beyond me. But what I
Yeah.
want to talk to you about is something that fascinates me, is
Mm,
about the animal sarcodes and
mm,
animal nosodes. I'll come to
mm,
what I'm talking about. For example, remedies like thyroidinum, pepsinum, pancreatinum.
mm,
Many of them are prepared from, for example, thyroid is prepared from the thyroid gland of the sheep.
mm,
Typically the lac pattern with the sheep patterns, with the thyroid pattern, for example.
mm,
Similarly, in animal group of remedies, as understandably it's also the topic for my tomorrow's newsletter, where there are many nosodes which are prepared from the animal tissue. For example, I'm going to give some example. For example, the horse, the equine family. So there are almost 5 remedies from equine family that we have. We have, of course,
mm,
lactobacillus, we all know, but castor equi, we have
mm,
hyposanium, we have melandrium. We also have a remedy called as hippomanes. Of
mm.
course, material, these are very well proved remedy, hyposanium, hippomanes,
Yeah.
and melandrium was used by Burnett many, many years back,
Yeah.
etc. What is your experience with these kind of, very interesting remedies which have an animal tissue background but are nosodes and sarcodes?
Mm, mm. Yeah, I'm trying to think if I have an example to give you. I remember prescribing vulpes, the pulmo vulpes of
Pulmovulpes, yes.
lung of the fox, but the lady she didn't come, she didn't follow up, so I didn't get to check how that prescription went. Um, Trying to think of another example of a clear cut outcome where I can say something interesting about it. But
For example, that's what, because when our discussion happened and I started understanding a lot of your experiences about mammal remedies and
yeah,
so on. So it was interesting for me to come back and study my cases. And this is the thing that I do more and more. That
mm,
if I get patterns, let's say if I see a child who's handling his genitals a lot, and I see a lot of patterns of mammal patterns in the mother's history during pregnancy. Let's say like equinum patterns. I will give
Right.
him melandrium. Melandrium has this particular
Ah.
cell, handles the genitals, and it's prepared from a particular disease tissue of the horse. So
Oh, okay.
many things
Is that
passed.
Greece?
Sorry.
Is the disease called Greece,
Ah,
or is
yes.
that a different one?
Yes.
Yeah, yeah,
I'm
yeah,
cross-checking it so that we don't.
yeah. Very good. I mean, to be honest, with children, very often I feel that tuberculinum bovinum is very often needed and useful in today's times and today's children.
Grease,
You know,
grease of the horse. You're right. Yeah.
yeah, Greece. Yeah,
Tuberculinum bovinum, you mentioned now perfectly well. It's interesting, and I have an interesting case. I had a case which had patterns of a bird, and I was thinking which bird could it be? And there
yeah,
was a strong family history of tuberculosis, and she had a lot of chest infection. I gave her tuberculinum aviare, which is the
yeah,
tuberculosis of the chicken,
yeah,
the hen.
yeah,
Uh,
yeah, yeah. Yeah, I've also tried that one, and it has been successful. We're in a patient where you could say the physiology of the patient is more, like light boned, and sort of maybe the appetite is more bird like, and certain hints like this you can use to choose a bird version rather than the cow version. Yeah,
because even tuberculinum bovine, right? It's bovine.
yeah,
It's actually prepared from a specific tissue from the bovis, from the
yeah,
bovine family. So it should
exactly.
have patterns of tubercular patterns and the bovine patterns if you really think about it.
Yeah, that's right. And I wonder whether the mammals that are made from glands rather than milk or hair or blood, whether they also have some different qualities that if you're really splitting hairs, maybe there are differences there. Yeah,
Yeah.
yeah.
It's very interesting, no? It's something that I came in the last, let's say in last 6 to 8 months is what I started using this kind of approach in cases, and just still at a very nascent stage, but very interesting.
Mm, mm.
I wanted to ask you how do you read this because of your experiences with animal and
Yeah. Currently, I'm trying to simplify things, and I feel there are three layers. There's the layer of the Geist and the Gemüts that Hahnemann says, which is I call the disposition. It's how the personality meets the world, and sometimes the patient has a problem here that needs a remedy. Then there's the constitution, which is more to do with the inherited body and the body type. And very, very often patients need help with this level before they need help with an issue to do with their personality and their sense of purpose. And this is what Kent calls the will. And then the constitution is more like the understanding, because you have to have your body has to work well, and it has to be able to convert the things that it's eating and be in the right environment for you to even stand a chance of achieving your purpose, right? So very often we need to help at that level. And then the third level is the miasmatic block, where the vital force isn't flowing properly, it's blocked somewhere. And very often in children, we need to work at that level first and open the case like that, with whether it's carcinosin, tuberculinum, serinum, even medarinum, are very common. And I think the bowel nosodes I see more where there are very marked behavioral difficulties, and yeah, yeah. So I'm trying to just strip things down and be quite basic with that, and try and understand the archetypal patterns, and and therefore the polycrest remedies I'm using increasingly at the moment, especially with children. So maybe start with tuberculinum and then move on to whether it's Nux vomica or sulfur or whatever is most indicated.
very classic type. This is how the old masters would prescribe, huh?
It's how
We
my
are
dad
going
used to
back to
work. Yeah,
basics.
yeah, I am.
From the
Yeah.
whole world of running and flying, and then we are back to
You know
where we
why?
started.
You know why? Because homeopathy needs to be easier, and it
Mm,
needs to be reproducible by lots of people, so that
yeah.
when a patient comes to the homeopath, they are getting more or less, they understand what the process will be like. They understand that it's going to be, it doesn't have to conform to a checklist, but it should be such that it's easier to practice, you know. um,
And I feel that more than easier to practice, it should be effective. I mean,
oh yeah,
it's only
yeah,
it's only going to work if it's effective. And if we really study our masters and you read all the cases right from Hahnemann to Ken to Erastus case, very often many of the masters would actually prescribe only on one, two, or three very sharp, peculiar symptoms.
mm,
And and for even lippy, for example,
yeah,
and of course it would be very peculiar and intense symptoms, but the results in such cases where they gave on that particular, like you mentioned, on what level you're prescribing is very
yeah,
important.
yeah.
That is the main thing, isn't it?
Yeah, you have to know which terrain you're in first and then act. So you have to, like Kent says, you can't just be mechanical. You have to be artistic about how you see the case and see the person. And you really have to ask what needs to be cured. And then whenever you repertorize, that needs to be at the forefront, like you always do your portrait of disease, right? Or you did
Yes.
nice, or you teach. And that's the exact same, it's nothing new, but it works.
Exactly. It's exactly how it is done in the classic homeopathy, classical homeopathy. So yeah, it's quite fascinating that we are back to where we started from, the basics of all our old masters. What they said remains true even now. I think our
Yeah,
parents have joined, huh?